Depression is one of the most common causes for hospitalization in adults age 45 and older. And here to answer your questions is Dr. Michelle DiBlasi, a psychiatrist at Tufts Medical Center. Nice to see you, doctor.
Great to see you, doctor. Thanks for your time. So let's take a look at the most recent federal data. Other than pregnancy, the number one reason why younger adults are hospitalized is for a blood infection that I can't pronounce, and I would butcher it. How do you pronounce that?
Septicemia.
Thank you. So, which is a blood infection, but numbers 2, 3, and 5 all involve mental health. What are some of the reasons why someone with one of those conditions would need to be hospitalized?
You know, those conditions can really range in severity from mild to really severe. But I think the way we know that somebody needs hospitalization is when there are serious safety concerns. So when somebody is starting to have thoughts about ending their life, thoughts about hurting other people, those are absolutely reasons for hospitalization. You know, other things we need to look for somebody who needs to be hospitalized are that they are starting to not be able to care for themselves, you know, not eating, not drinking, not caring for hygiene, and then just really making really reckless decisions that could put themselves or others in danger. Those are going to all be reasons for hospitalization.
And those signs would be fairly obvious too, yeah.
Doctor, the National Alliance on Mental Illness says that the average delay between the onset of symptoms and treatment is 11 years. So do you think if patients got treatment earlier, they might be able to avoid some of the most serious symptoms of their mental illness?
Absolutely. And we know this. Studies show that the earlier we get help for our mental illness, the better our outcome and our prognosis. So, you know, having a mental illness is a lot of suffering. And if we can get help earlier, we can relieve ourselves of a lot of suffering and also hopefully make it so it's not so debilitating. It doesn't take over our whole lives for that long of a time. So it's very important to reach out for help sooner rather than later.
Doctor, the National Alliance on Mental Illness also says that 32% of Americans with a mental illness also experience a substance use disorder with alcohol or other drugs. So what would you like their families to know about that connection?
You know, as I was just talking about, having a mental illness is a lot of suffering. You know, people are really depressed. They're really anxious. They might be hearing bothersome voices all day long. And especially if they don't have access to mental health care, they're going to be looking for ways to deal with that suffering and that stress. And so one of those ways is substances. So as a result, substance use disorders are really highly comorbid with people who have mental health issues. The other thing I would say to families is that when somebody has mental illness, they're not thinking clearly. Their insight is impaired, their judgment is impaired, and so they're making decisions they wouldn't normally be making. And so that could include, you know, using or abusing substances.
Dr. DiBlasi, thank you so much for your time today. We appreciate it.
Thank
Stay
you,
well. And to our viewers, if you have any mental health questions that you would like our experts to answer, just email them to ask@wcvb.com.
We turn to 5 on your